The Pitt is showing everyone what it's like to work in the emergency department, but there's an entire landscape of emergency medicine careers no one talks about, and many pre-meds and med students don't even know these paths exist. Dr. Jubal, MedschoolInsiders.com. While it's not necessary to subspecialize for a career in emergency medicine, a fellowship can help you design the ideal job for you. And you have tons of options, so let's not waste any time. First up is emergency medical services. If you've ever wondered who designs the protocols paramedics follow, or who decides which patients get airlifted versus driven to the hospital, that's an EMS physician. You'll split time between clinical EM shifts and medical director roles, and many EMS docs work with fire departments, air medical services, or disaster response teams. It's a leadership-heavy path, and if you're drawn to systems-level thinking over individual patient encounters, this is your lane. Let's move from overseeing pre-hospital systems to one of the most detective-like subspecialties in medicine, medical toxicology. It's 2 a.m. A 19-year-old is wheeled in, obtunded, with pinpoint pupils and a heart rate of 40. His friends say he took something at a party, but they don't know what. As a medical toxicologist, this is your bread and butter. You're the one who identifies the toxidrome, decides whether to push naloxone or atropine, and manages the multi-organ fallout when someone ingests something they shouldn't have. You'll typically work at academic centers or regional poison control centers, managing both acute overdoses and chronic poisoning cases. Now let's shift from toxins to tiny humans, because pediatric emergency medicine is an entirely different world. Kids aren't just small adults. From their physiology, to their dosing, to their airways, everything requires recalibration. And the emotional stakes are higher because you're not just treating a patient, you're dealing with an entire terrified family. Most pediatric EM physicians work at children's hospitals. The pace can be intense, and the cases range from routine ear infections to genuine life or death emergencies. Next, we have sports medicine. Sports medicine trained EM physicians handle everything from sideline coverage to managing complex athletic injuries in the clinic. Your life looks very different from that of a typical EM doctor. Many sports medicine physicians work clinic-based schedules with team coverage on evenings or weekends. It's one of the better lifestyle subspecialties, with more predictable hours, fewer overnight shifts, and the chance to work with athletes at every level. Next, critical care medicine brings us back inside the hospital, but past the ED and into the ICU. EM-trained intensivists manage ventilators, titrate vasopressors, and lead resuscitations. There are several critical care pathways available to EM physicians, including anesthesiology critical care, internal medicine critical care, neurocritical care, and surgical critical care. The work-life balance across these paths is actually solid, as many intensivists work week-on, week-off schedules. And because your EM training already made you an expert in resuscitation, you'll enter fellowship with a significant head start over other applicants. From the chaos of critical care, let's pivot to pain medicine. Pain medicine is often more predictable than general EM work, giving you greater control over your schedule depending on where you practice. It's a field that continues to grow as healthcare systems are increasingly recognizing pain management as a specialty in its own right. But before we get to the next options, let's first take a step back. Is emergency medicine right for you? If you're unsure, looking for more options, or trying to decide between two specialties, check out specialtyquiz.com. It asks you questions about your preferences, priorities, and how you'd handle hypothetical scenarios, and matches you to specialties based on 9 personality traits. Once you know EM is your path, these subspecialties become the next major decision. Now, let's dive into one of the most unique subspecialties in all of medicine, literally undersea and hyperbaric medicine. These physicians are the experts in dive injuries, hyperbaric oxygen therapy, and conditions caused by extreme pressure changes. You'll typically work at medical centers with dedicated hyperbaric facilities. It's a niche path, but if you're fascinated by physiology at the extremes, this subspecialty offers something no other field can match. Up next is hospice and palliative medicine. You'll work with patients facing life-limiting illnesses, managing their physical symptoms while addressing the psychological, social, and spiritual dimensions of end-of-life care. For EM physicians who want to bring comfort and dignity to patients at the end of life, rather than just stabilizing and transferring, this is your path. And finally, let's leave the hospital and civilization altogether. Wilderness medicine trains you for remote environments where resources are scarce and improvisation is survival. You'll learn to manage trauma trauma, altitude sickness, hypothermia, and envenomations with whatever you have available. Some work with search and rescue teams, expedition groups, or adventure medicine organizations. Others incorporate wilderness principles into their regular EM practice or pursue academic roles in the field. Beyond these 9, emergency medicine offers several other fellowship options. Ultrasound, also known as POCUS, makes you the expert your department calls when the diagnosis is unclear and the probe might have the answer. Many split their time between clinical shifts and education, running ultrasound curricula and training residents. Addiction medicine focuses on patients with substance use disorders, a population EM doctors encounter constantly but rarely have formal training to treat comprehensively. Brain injury medicine specializes in the recovery and rehabilitation of patients with traumatic brain injuries, though this path requires completing a sports medicine fellowship first. Disaster and tactical medicine trains you for mass casualty events and high-risk law enforcement operations. Medical education and simulation is ideal if you want to shape how the next generation of EM physicians is trained. Forensic emergency medicine bridges medicine and the legal system with expert testimony, evidence documentation, and law enforcement collaboration. Clinical informatics focuses on optimizing health IT systems and EHR workflows. It's less clinical, but increasingly important as healthcare continues to digitize. Even after this comprehensive list, there are still niche and emerging emergency medicine subspecialties to look out for, including international emergency medicine, pediatric ultrasound, telemedicine or virtual EM, women's health, aerospace medicine, and occupational and environmental health. Check out our Can You Handle Emergency Medicine videos to see if following the path of Dr. Robbie is the best for you.